Mama?
Mama. That is me. Not Mama, but Mama. I never thought I would care. I mean, do I care? Does it matter that my son calls me Mama and not Mama? That my name sounds funny when he says it, though he tries? That my words come out in Spanish, but he says English when he replies?
Te amo.
Except when he says that. Te amo. How is he in our bed every day? I don't know. I do know. I don't care. Gina Ford would say I failed. Oh, how much he slept on me, next to me, attached to my boobs for hours every day. But we slept, sort of. It was the only way we sort of slept. It is the only way we sort of sleep. What is sleep?
How many more minutes until you get up?
Sleep is like that friend that keeps you sane. So you take it. However much or little you can take, you just do. Fingers tingling, legs cramping, 4 trips to the loo at night. That was the kind of sleep I had last night.
Chickens!
I'm from Mexico City. Nobody owns chickens there. Not if you live in a posh house in the city. Although, I don't know anymore. I feel like I don't know anymore. 15 years since I left. I'm from there. Oh, I'm from there. But I somehow feel I'm not from there. So how would I know? When I talk about my country, I now just stop because I feel like I don't know. I don't know anymore. I owe our chickens not looking at my phone when I wake up. I never really owned pets in my life apart from a turtle that died within days and a puppy my dad's secretary gave us and was sort of locked up by my mom in the roof terrace of my house for months until we finally gave it away and released it from what now seems to me like prolonged trauma. I didn't grow up appreciating animals or nature. My life was cars and pollution and shopping centers. But now, chickens. Who even am I?
Mama, can you play with me?
A playmate. That's what I am. On the good days. On most days, I play. But really, I don't play. I may be 1 meter away, but really, I'm miles away. Plugging in for one thing and finding 100 essential issues on the way. Motherhood changes you. And so can social media. My son's got a cavity in one of his adult molars. Oh no, I thought. A simple feeling would do the job, the dentist said. Am I a lunatic if I challenge science by also trusting in natural healing? Some on Twitter seem to think so. But did you know it's apparently possible to heal tooth decay naturally? Some on Facebook seem to think so. And a ton of books as well, to be fair. I'm giving it a go. Does that make me a bad mother? Because I certainly carry the guilt. ¿Y si la muela se pone peor? Piensa en tu hijo. That is precisely what I'm doing. I'd go for the easier option otherwise. Isn't that one of the aims of medicine? That it makes our lives easier? But does it? Am I being stupid asking this question? I mean, medicine saved my husband. Doctors fixed his heart so he could live. And he does. And although I wouldn't say they've made my life any easier, I sure am grateful. But can we also play a part in our own healing? And does it matter? I'll tell you what's easier. To be blind. To not know. To let others know. It's scary reflecting on this. Terrifying to share it. the fear of being called an idiot, a nutter, delusional. Kierkegaard said, wherever there is a crowd, there is some truth. And the crowd out there is loud. So now so many doubts, so many questions. What's true seems blurry. But the truth really is what I seek.
I'm hungry.
Decisions. Easier to take in times of no social media. Whatever the doctors or scientists said, I did. They are the experts, not me, I thought. In fact, I still think so. But suddenly the number of experts out there seems overwhelming. Who to believe? What to believe? So here we are anyway. From a nearly vegan diet because some experts say it's best, to eating purely organic eggs from our own garden because other experts claim it's better. Confusion. And all to heal this tooth. Naturally. Why? The voices in my head speak up. More confusion. Oh, I've so been tempted to disconnect, flush my phone down the toilet. But then how do I connect? I may be British, but I'm still an immigrant. A Mexican, really, in the middle of the English countryside. A blessing and a riddle. Everyone so polite, yet everyone distant. My phone is where my friends are. Literally. They say it takes a village to raise a child. Pero ay, mi familia, mis amigos, mi lengua, las risas, las fiestas, las comidas, el ruido, el olor, el color, el aire, el calor, los aguacates, chicos zapotes, unas gorditas. When there's no village, though, there's always Google, WhatsApp, YouTube, Twitter, Facebook, Instagram. Am I alone in this? Am I alone? It was my choice, though. I had a choice. The privilege of choosing. To leave for a new home, a new lover, a new life, a new opportunity, a new adventure. No village is perfect, as long as there is one.
Bye-bye, Mama.
Mama. It's not perfect.
See you in a bit.
One touch. That's not perfect either. But what is? What is?
Hi everyone, really nice to have everybody here, and I really hope everyone watching and everyone who's just seen the piece has really enjoyed it as much as I have and as much as we have. So I think it'll be quite nice just to sort of go around and see what people felt of what we've just seen and how that sort of resonates with them and how it sort of fits into the antimicrobial sort of resistance and issues that we face today. I don't know whether Sue, you fancy kicking us off with what you feel.
I thought it was really interesting, and I think one of the things that it really brought out is that it doesn't matter what we do as professionals, that everything comes down to what somebody's actually doing in their own home with whatever information, with whatever supplies, whatever we actually give to them. And that we've got to be really clear about making sure that patients know what's going on, get access into enough information so that they feel empowered to look after themselves, to look after their families, and to actually take part in, particularly in this whole debate around AMR, And I'm hoping we're going to have a chance to talk today about how that fits in with clinical trials and how we get people to feel that empowerment.
Yeah, absolutely. I agree. Brendan, what did you feel about it?
Yeah, I really enjoyed the piece, and I agree with Sue. I think we have to, as scientists, have to give people the tools and enable them to understand and have sufficient literacy around these issues to make clear decisions about their own healthcare, about how they sift through the wave of data that comes and information and misinformation that comes to people day and daily through various channels. So it really is, I feel, incumbent on us, learned societies, universities, the NHS, etc., to help patients and ultimately patients understand the scientific data that is presented to them.
Yeah, and be exploring about what we've got right and what we've got wrong in this. I'd be really interested, because I think, there's so much that I think we believe we're doing right, and so much we're probably getting wrong. And sort of having a bit of a discussion about that was what I was quite interested in. And Melissa, what did you think?
I think my personal perspective is a little bit different, because I lived in a different country, and I trained myself as microbiology in different country, and I used to work as well in public health sector, and it's completely different to how we handle here everything. So obviously my personal perspective, it will be the obvious one, that we have so much to do in terms of, at least in my country, Central America, we have so much to do in terms of method standardizations, AMR surveillance, I don't know, data management, and all of that kind of thing. So it's very basic for us, but for us, it's just a big step that we have to just overcome. So I'm quite interested in all of this at the moment.
And I was really interested in your perspective as well around having to interact with the healthcare system in a different language.
Yes, it is. But I mean, I've been living here for a long time now. But in terms of handling antimicrobial resistance, I still have in my head imprinted what I learned from over there and how we used to handle everything and the issues that we used to have in terms of like even to lack of reagents, the miscommunication between medical team and the microbiology team, the lack of trust in results, the use of private sectors, self-medication of the patients, because some of them, they couldn't afford to go to the doctor or pay for a clinic. So for us, it's easy to just go to the pharmacy and say, give me some amoxicillin and tetracycline, treat a common cold. And my mom does that. She's still doing that. And I can see how in here we have so much done in many ways, but we still have quite a lot far away in Latin American countries or low-income countries to tackle that kind of, to get into the same level.
Yeah, I think for me, the piece sort of touched upon a few important aspects that doesn't say it outright blatantly. It just sort of implies a lot of it. It sort of, and some of the important things that it sort of implies is that role of social media that we have on everything that we do these days, and especially with our interaction with healthcare, and how a lot of information that we feel is important can either get lost or diluted, and people's importance and reliance on social media, the echo chambers that people have within their own field, and trying to break down those barriers, and her, as you really importantly say, it's her sort of feeling of isolation that she's got within that, and having to sort of feel her way through healthcare within her own beliefs, but also trying to do the best for the children that she has. And sometimes that sort of butts against what the norm is, and whether she feels bad about that, and how we actually communicate it, because we are, in some way on one side of the debate, because we often talk about it a lot as part of our job, as part of our daily routine, whereas a lot of other people just dip in and out of this. And I don't know, I thought one of the things that I've always wondered, and I'd be interested to see what people think, is, we talk about antimicrobial resistance, or AMR. I think that's a really difficult term for the public to understand.
I completely agree.
It's like our branding right from the beginning is wrong. And it is how we get that very complex, and it is complex, ideas out to make it understandable. And I don't know how
I think the thing that I've seen around that is that people believe it's their fault, whereas it's not. It's about the microbe. But if you tell people, well, you shouldn't take antibiotics, or you need to finish the course, or we're going to not actually prescribe antibiotics at this point, they think it's their fault. And if you're the parent of a child, particularly with an orphan disease or a rare disease, then you're going to do whatever you can in order to protect your child, in order to get them medicine. And somebody saying, well, this is going to have massive worldwide effects as a result of all the prescribing policy that happens across everybody, they're genuinely not going to care, because it's going to be about their child and what happens to them. And you see that tremendously throughout rare disease groups talking on social media and things like that about, can they get into a clinical trial? Will they get access? And really, parents in particular, if they're talking about their kids, will do whatever it takes. And I think that we need, as professionals, to actually really think about that, and think about how well educated people are if they have a child with an orphan disease in particular, or something like that, because they are going to do a terrific amount of research and try and find out everything they possibly can. And so they dismiss parents a lot of the time as being, they're Google doctors, but actually a huge number of them have really massively educated themselves. So we've got to give them a lot more credence for what they've done and how they've interacted with the scientific literature, and be able to present things to them in different ways to address their level of understanding. And I think that's something that's terribly important for us to get in place.
I really agree with that point, Sue, because I think that it's very difficult to speak to, especially sectors, about any sector about AMR, without there being a feeling of blame. And even in the movie, there is the sort of implicit feeling of marginalization, which, contributes to health inequalities and creates a kind of an inequality within the system because of marginalization and feeling of guilt, as you say. And it is very, very difficult to communicate in the AMR space without saying it's someone's fault, your inappropriate prescribing or overuse. It implies that someone is dropping the ball, when in fact, so as someone said, there's plenty of blame to go around. And it doesn't help. It blocks the conversation up if we start to get out the blame card. So yeah, it's a really interesting point, but I hadn't ever considered it from the patient point of view of feeling the blame like that. So that's something that.
And this is why we could have conversations, because we've all got to stand each other.
Yeah, I think you touched on a really good point, because why would people feel guilty about it? Well, people feel guilty because we have tried to drive home a certain message for the good. We're doing this for a purpose. But actually, at sometimes you need those antibiotics, you need those times, and therefore you feel slightly guilty that you then go and do this. And so much in society as we try to bring home a message about one thing, but actually the unintended consequence of driving that message home actually sometimes marginalize people on that. And that dialogue's really, really, really quite something, isn't it? And I don't know what people felt, but I before the pandemic hit, before COVID hit and everything, I thought we were doing quite well in getting the agenda of AMR quite high up. The Chief Medical Officer, Dame Sally, really sort of championed it. And I thought we were getting somewhere. But what I don't know is whether that was actually really getting out to the public, because in my little sphere of sort of, and I go back to my echo chamber here, I thought we were sort of really doing quite well. But actually, are we doing that well?
I think Wellcome have produced some data recently, and it seems that there has been a little bit of a backstep, I think, in public understanding of AMR. And I'm not sure if that is to do with saturation. We had the O'Neill review, which is very high profile. But there does seem to be some evidence emerging that people are less concerned than they were about AMR, which is really worrying, because if you look at the overall picture, I think we probably all agree that it's getting worse, not better. You know, one of the areas that I'm particularly interested in is the antimicrobial pipeline. And if we look in the last 4 years, the numbers of antibiotic candidates coming forward has decreased. The number of companies involved has decreased. For example, in 2017, there were 5 of the top pharma companies by sales employed in antibiotic research and development. Now it's only 1.
Yes, that's a huge step.
And 75% of the companies that are advancing these 40 or so compounds are pre-revenue, whereas in 2017 that was around half. So there have been major steps back the way. And I know the questions about public understanding of AMR. I think there's also evidence that, at least anecdotally, that perhaps as a society we don't feel it just as keenly. So I think we have a lot of work to do to get back, to get the message back on the agenda, you know, as we emerge from a global pandemic into what I would see AMR as another.
I think I feel much more positive about the pre-revenue status than you, because I see that as a really good thing that's coming out of people's PhDs and people's hunches in order to try and get compounds which would never previously been looked at. And so I actually think once we get those up to a stage where if they can get into phase 2, phase 3 and don't fail at that point, which has been our problem over the last few years, then I think that puts us in a greater place. But I also think the public have got a lot on their plate right now.
Yeah.
And that's the problem. And trying to give them here's all the COVID messages you've got to worry about. Here's everything else you've got to worry about. Oh, and by the way, could you just take
AMR.
into account, AMR, please don't take any antibiotics if you don't need to.
Yeah.
Oh, look, let's have little pictures of pills on a nice advert on the television. And all of those have been replaced with the wash your hands, put your mask on, all of that.
I feel at the moment that it's just so much going on in terms of the COVID that everything gets masked by it. I mean, I just find it difficult when, for example, my mother-in-law or my sister-in-law ask me questions, not to sound preachy, telling them, do not do this, do not do that. And by the way, just complete your antibiotic course, please, because this and that. They don't really, it's just like in their ears, it sounds like blah, blah, blah. And they are not getting anything. So I think we have to be careful as well how we convey the message to the public, not sound too preachy or too informative.
But it's a really good point, isn't it? Because when do we start this conversation again? Because somebody could, you could say that actually we've never been more focused on healthcare, and this is the time that we should do something about it. But also we're kind of sick of the fear of illness at the moment, because everyone's personally been touched by current events and the pandemic. Do we really want now people to tell us that we're all gonna antibiotics gonna work and surgery might be a problem in the future, etc., etc.? And so I don't think that now is right, but when is the next time to engage this? And I think us as a community in who working in all the little avenues that we're doing need to sort of think about, we can't wait because this is such an important topic, but we also need to find the right time, because disengagement would be really harmful for us and putting the public off.
But I think you touched on a brilliant point there, which is about how engaged the public is. And so very shortly must be the right time in which we start talking to them and treating them like educated individuals, and treating them like they actually have a part to play in all of this. I think what's been done in the past a lot of the time has been really preachy, and has told them how wrong they are and how they've done things wrong. Whereas actually saying, we've come through all of this together. Now let's talk about the reasons why this is going to be a problem. That I don't know whether you'll remember, a long time ago, there was a really amazing Horizon program, which showed us 5 different avenues of research that we should be going into and where the money should be going. The first one of those, if I remember rightly, that came up was AMR. And people just weren't prepared for that because they'd never considered that that was going to be an issue. And so there was lots of more enthusiasm around things around AI, whereas I think now is a much better place, because people have been worried about their health so much, to be able to kind of grasp that at this stage and say, actually, what is going to make it easier for you to participate in this? Let us tell you these facts and let's get more information back from you on how we can make it better for people.
Yeah. I think maybe it's where we have the conversation right now that we need to consider. I'm not sure that having it with the public. I think of all of the avenues in AMR progress or progress against AMR, I think actually getting the message across to the public has been probably the most successful of those avenues. Where we're lacking is anywhere that really required any level of investment. I think that's been really highlighted. But as society, we typically act late on major problems like climate change or pension crisis or AMR. So I think maybe we need to consider where we have the conversations. Is it with government? Is it with pharma? Who's having these conversations? I think maybe the public are fatigued and need a break from the finger wagging and those kind of messages, because actually I think that has been a successful aspect of the AMR campaign, is actually getting the message out and saying that this is a big problem. And I think your average man or woman on the street would have a fair idea of some of the issues around AMR. So that message, I think, has gotten across maybe better than some others, and it's now we just have to refocus. But it's right, we have to keep the conversation going in some direction, but in terms of all the information that's coming to patients, we need to be very careful. We're adding more information onto a fatigued patient body, I think.
Yeah, and it's I wrote down two. It's interesting we had that, because I wrote down 2 things from the piece that we saw that was said, and the 2 things that I wrote down were that she says, number of experts out there seems overwhelming, who to believe, and then she says it's easier to be blind, to not know, to let others know. So I'm saying there's too much avenue of information. There's lots of experts. I'm not sure. This whole expert fatigue we've seen for many, not just in healthcare. And maybe it's easier to be blind and let other people know. Maybe I need a bit of help here. Maybe it is time that I need others to help me through this. And it kind of goes on to Sue obviously does loads in clinical trials, and we need to, yes, the public engagement, we need to get pharmacy, we need to get industry, we need to get those pipelines. But actually doing these research is really difficult, because it's not a very attractive thing to do. The trials are complex, the patient groups are difficult to select, and I just think it's, in a way, sometimes it's easy to have one virus, one vaccine, everyone needs the vaccine, then it needs to have lots of different conditions, lots of different antibiotics, and then they have a whole bunch of people like myself turn around and say, well, you must not take this drug. So why on earth would pharmacy industry sort of see that as a priority?
And another thing that I think is important is that outside the clinical settings, we have the misuse of antimicrobials in animals, in agriculture, food processing, and all of that kind of thing. So just because the food is organic, it doesn't mean that it's free of antibiotics. So that is something that the public needs to understand as well. So how we convey that to the public, how we deliver that kind of message is important as well. So this is a different venue to explore.
So I mean, if you're a patient turning up at a hospital and you have some sort of infectious disease, at this stage, unless your consultant or your house, whatever it is, whoever you see as your healthcare professional says, oh, we've got this clinical trial happening, would you like to be on it? There are very few methodologies by which a patient can find out how they might get access to a clinical trial. And I think that's something that we really need to address, giving a more straightforward way of people finding out what might be going on at their own hospital, or indeed at another hospital potentially in the local vicinity or in the same country at least. But then we've got to make sure that we're in a position where if we do get a patient to come onto a trial, that it's as easy as possible for them to take part in it. Because if we put barriers in the way, so the things that are putting people off at the moment, people do not want to travel to a hospital to take part in a site visit because they're going to come into contact with people who in their heads have all got COVID, and they will be exposing themselves to huge risk. And at the end of COVID, I don't know what the full thought about this is, but there's certainly within the groups of people I'm talking to, there's a huge panic that we'll then have all of the infectious diseases that we haven't had because we've not been interacting with each other. And so suddenly we're going to have more colds, more flu, and all of those things. So we've got to make the atmosphere of coming and taking part in studies to be something that's much more attractive, and find ways of allowing patients to interact with that, with home visits, for example, with making direct patient deliveries of their drug supplies so that they don't have to go and collect it and things like that. But all of this, of course, has associated cost. And so we've had to find some level of happy medium by which the public are prepared to find out what's going on and give them good ways of doing that, and then to make it possible for them to participate in a way that they don't have additional anxiety and worry about it.
Some big challenges there, aren't there?
Oh, very much so.
And it's finding those answers is quite difficult.
And then what happens on social media, and who's talking to who about what drug they're going to have and all of that. And so, yeah, you get small communities of people who talk to each other very intensely about what's going on.
And there is so much misinformation in the media as well that people tend to read, and as she was saying about, alternative medication or anything, and it's just very difficult for the public to decide what is the right thing to do and what is not, when they don't have anymore the easy way to just contact the GP and talk to them face to face. I mean, they tend to go for online checkup.
Yeah.
According how I feel today, or I got cough, it might be this, might that. So it's very difficult for the public to get to understand all of these terms.
I agree, and it's very difficult for the public to find an authentic, authoritative voice, because there are so many, and so many people using their profile to advance a particular set of information that it can be very, very confusing, and to find that authoritative voice.
WhatsApp is one of them. They just send kind of messages everywhere, and people just keep forwarding, but it's difficult to get the right information.
I mean, I feel very privileged that I know a number of healthcare professionals who I can say, what do you think about this? But then even me, in the privileged position that I'm in, is I don't then actually want to go to all of the healthcare professionals that I know, on the basis that I know that loads of other people are going to be asking them that as well. And that they shouldn't be trying to be the voice for everybody. It's a very big thing to put onto somebody.
Yeah, I mean, it certainly is an interesting time to be an infection specialist in a pandemic,
sure.
because you probably all know, people ask a lot, friends and family, and worried. And I think it is that sort of, where do you find your information, and where do you go? Because it is quite challenging. And do you trust the authorities that are that are giving information to you, if there's a lot of distrust in other avenues that they're getting information from on social media? And I think that's a really important, I don't really want to say barrier, but that's a really important thing that healthcare professionals need to proactively engage with, because otherwise we will never get the communication out that we really want, or the message that we want, or the message that we know is the right message to help people. I mean, I think it's quite an important, it's such an important topic, and a topic that's not going to go away. It's not like, well, we hope that you get these, these infections that come and they go and they'll be quiescent. This just feels, antibiotic resistance and the use of antibiotics, that's been with us for decades and will be with us for decades going forward. And so our sort of dialogue and message and everything is of increasing importance. And Brendan, you mentioned this before, didn't you, that this is, this isn't going away, this is getting worse. It's certainly within the hospital environment. We're doing some good stuff in the community. I think everyone sort of gets that message about, oh, it's a virus, don't need antibiotics. I think we've done very well with that message. I think, community and, having, whether it be rescue packs with antibiotics if you're unwell, or, GPs have done incredibly well, and prescribing data shows that on a national basis. But in hospitals, resistance is increasing, and how we tackle that is a really, I don't know, it's my, it's what I do every day, but it's, keeps me in a job because it is such a challenge.
Yeah.
I think it's, there's one thing about, I think, Melissa, you mentioned it before, but it was about, she says in the play, can, play a part in my own healing, what alternative therapies, and I find that a bit difficult because, it's very easy in sort of, I guess these people would have called it Western medicine, but in sort of the medicine that we practice, is anything that isn't the medicine we practice is alternative, and everything that's alternative doesn't have a place. And actually, I'm not sure that is a very helpful thing, because actually a lot of people either rightly or wrongly have reliance or importance, or is an important part of their health agenda, and is cultural, and is sometimes it's culture, in some ways it's sort of things have been grown up with, and actually dismissing it, I don't think it's very helpful. Do you think?
Actually, I just identify with her, with her on the play, because being from Latin America, we have quite similar ways to live and see things, and it's obviously countries like mine, many people don't have the access to the healthcare system like we have in here. Public healthcare over there is a little bit more, it needs quite a lot of work, and they tend to go quite a lot to private sectors, and some of them they cannot afford it. So that's why they have to go through alternative medicine, like I don't know, drinking ginger tea when you have some sort of cold, because you don't have access to that, or self-medication, just go to the pharmacy and get amoxicillin and all of that kind of thing. So I can rely on that situation about alternative medicine, because it's different, and it's completely different setting to what is in developing countries to what is low income countries. So to bring that message to people across is difficult.
That's not confined to developing countries. In this country, if you've got a cold, somebody says, well, have some whiskey, some honey, and some lemon and hot water.
And help just the symptoms.
And you feel a bit better after you've done that. So you can't limit that into developing countries. But I think
probably the whiskey.
Yeah, I think it's incredibly arrogant that we dismiss all other medicine.
People mention, for example, chicken broth. And actually, it's nice to have something warm to go through your, to your chest and everything. But it's true. It's difficult to get that idea right.
Or what do they call it? Jewish penicillin, isn't it?
Jewish penicillin.
Chicken soup.
Yeah.
Chicken soup.
Chicken soup.
But I mean, we know that there is such a psychological component to illness, whether that's pain or that's your, and we know that and so, yes, okay, fine, we might not, be able to tie in a clinical trial with different receptors of this and this and this, but if there is something that makes you feel better, your reaction to your illness is going to make you feel better, and whether that's chicken soup or whether that's, for me, it would be the whiskey, or whether it be, it has that part to play within the package of your illness that you're feeling, I think. So I think dismissing it, like Sue says, is arrogant you know, I agree with that.
Yeah, and people feel compelled to act when there is a problem, right? So, and very often that has meant they've gone, if they have access to healthcare, they go to their healthcare professional, and then that compulsion to act is passed on to them, which has maybe led to, in the past, and I know we've made great strides against that, but in the past, to prescribing antibiotics, etc. My only concern with other therapies is knowing when those therapies might delay people presenting to access healthcare, that when that avenue has been exhausted. I think anything that could potentially delay access to appropriate care, you know, we have to exercise caution around that. But I absolutely agree that it's extremely arrogant to apply a completely Western medicine-centric view. But understanding and helping patients understand, you know, when that threshold has been reached of when to access perhaps another avenue of care, I think that I get concerned around that. That's my
Yep.
sort of opinion.
And that all comes
Absolutely.
back to my starting point of having educated, sensible, intimate conversations with people and giving them access to enough information and not treating them like all they're looking at is Dr. Google, because there's plenty of people who have educated them to a much greater extent than that, and that they shouldn't be getting their healthcare information from a tabloid newspaper, which is what people have done so much over COVID.
Yeah.
Yes, definitely.
I agree, and I think my wife's a GP, and I think you know, when people sort of think, there seems to also be a little bit of a default is I'll go to my GP for this thing. But actually, the healthcare professionals, there's such a wide variety that are highly qualified and skilled in giving information, that actually there are more avenues. They're not restricted as much, that I think, you know, we can build upon all the experts within pharmacy, within healthcare science, within medicine, within nursing, within, you know, all of these avenues that I think is really important. And so it's really important for us to be educating all of the healthcare professionals to a standard that then can deliver the what the public needs to understand that. And actually, I think, you know, we have a role to be able to teach people in order to communicate in a way that is effective, not in a way that's overly technical or overly, you know, you must do this. And I think there is something in that engagement and communication that is important.
It's difficult to get it right, isn't it?
Yeah,
It's impossible. Whatever you do is going to be wrong.
It's difficult to get it
But
right.
if you get to anybody,
yeah.
I trained as a pharmacist, and so I worked for about 1.5 years in community pharmacy. And you know, when I was going through my pharmacy undergraduate, one of the kind of images that was being portrayed in the profession was that pharmacists were the scientists in the high street. So this idea that you could go in and speak to your pharmacist and ask them sort of questions, because lots of people bring in the headline from the newspaper, you know, that was around the time of the MMR issue, and patients were really afraid of all this, you know, misinformation that was in tabloid press and another mainstream press about the dangers of vaccination, etc. And I do think that the public, you know, it is a great investment to have that facility for the public, to have somewhere to go to access accurate information. Because as soon as you hit Google, you get a bombardment, and some of it's correct and some of it's
not.
that's right. Trying to work out which.
Yeah, and some of it's close enough to correct to be dangerous.
Yeah.
yeah.
And that for me, I think, you know, there are things that can be invested in, like a network of healthcare professionals that are educated in communicating accurate information in a way that patients can, you know, really interact with. And so you're right, patients are very, very well informed, you know, and they have made a lot of, you know, they have sifted through a lot of information and made sort of judgments on what's accurate and what's inaccurate and what are reliable sources and what are, but still nagging doubts creep in, about vaccinations or about, whatever the healthcare issue might be. And just accessing that authoritative voice, I think, is really important.
And then, as you said earlier, then you get these whole echo chambers sitting on Facebook or on WhatsApp or whatever, where if you start going down the anti-vax group, then you can tumble down this whole spiral and never get back out again. Yeah. Whereas if you're talking to a group of people who've got, for example, I've been working with the Black Bone Disease organization for a number of years, and they've got an incredibly educated group of people who all talk to each other, who say, oh, do you know about this thing that's come out? There was this piece of data and all of that. So it's about which kind of segment you sit in. I think it makes a lot of difference. If you're just is a harsh word, but if you are a member of the general public who could be siphoned off into that whole anti-vax or anti whatever it is, rather than being part of a very specific patient group, there's much more danger of you being pulled along.
Yeah, no, I agree. I think what I was just thinking about was actually, and it goes back to a conversation we had earlier, is when is the time to communicate with the public or re-engage the AMR thing? Because it's a bit of a balancing act at the moment. Mm-hmm. But actually what we do have is a buy-in in healthcare from a, how do we want our healthcare to look in the future? So maybe it isn't about, at this point, it's about trying to get everything that we want and need, because there's a real focus on healthcare, to then go and engage in the pub and get our messages out. Because I think there's an opportunity for us to invest in the stuff that we need and get the investment that we need. And I think there may be something in that, and then when we can get our messages correct, we can then sort of take them out there. I don't know.
I think events like these, like Nosocomial or groups like these, they really help because they convey the information to the public in the easiest way, not in the preachy way. But I think that these kind of things, they should be more available for the public.
Yeah, I know. I think it's good. So, knowing time and time conscious and sort of wanting to wrap things up, and I really hope it's been sort of a stimulating sort of for anybody watching that has enjoyed it. Is there any key messages or anything that anybody wanted to sort of to bring out at the end? I mean, I'll just I guess I'll start, and I think for me, my sort of key messages is that it's really simply that the antimicrobial resistance is still an important topic. It's something that is the dialogue feels that it might have gone away, but the issue hasn't gone away, and that we as healthcare professionals need to re-engage in this dialogue, and in a very open, transparent, non-blame way, and advocate from on our patients' behalf to get the investment we need, but also we need the public to help me or any of us to know how to communicate. I think the piece said that nicely, and I think some of the great conversations we've had today said that to me as well. I don't know whether anybody else has any reflections.
I really want people to keep talking to each other. I think that's the most crucial thing we can do. If in 10 years time or 15 years time or whatever, I need a hip operation, I really want to be in a position where that can actually happen. And so it's in my interest, it's in everybody's interest that we all continue to have all of these conversations and to try and find ways that we can pitch things to people so that they can understand them in a clear way.
Well, I say my message will be that antimicrobial resistance is just not the clinical settings, it's outside the clinical settings, as I mentioned before. We have to think about how we spread and how we misuse antibiotics can spread antibiotic resistance in different environments in agriculture, animal processing, food, and all of that. So I think it's important to carry on talking about these issues.
Yeah, from my perspective, I think it's been really useful speaking within this panel, even the multidisciplinary panel, speaking to each other, not just to the public, but to each other, and understanding our own perspectives. And I would say, you know, antibiotic resistance is something that predates us introducing antibiotics into the clinic in the 1940s. And it's something that we're going to have for as long as we use antibiotics. So the conversation for me is about, one of the main conversations is about building a system that is going to, you know, acknowledge that and help us get through however many more years with a system that sustainably delivers antibiotics.
Brilliant. Thank you, everybody.
Thank you,
And,
everybody.
Thanks very much.
Yeah,
Thank you
thank you.
Thank you
It's been
very
great.
much.
Cheers.
Cheers.